Life begins with a dream, the promise of hope, and yet it can end in tragedy, an entirely avoidable tragedy. A tragedy with a name, malnutrition. You already know that malnutrition is the result of eating too little or too much of food, or in other words, the specific nutrients it contains. Eating too much causes overnutrition, and eating too little causes undernutrition. This visual shows you the state of balance in the body when nutrient intake matches nutrient need. When nutrient intake is too low or too high, this state of balance is upset. In this program, we will concentrate only on the problems caused by low intake of nutrients, or in other words, the nutritional deficiency disorders. This is the typical face of undernutrition. A child thin, emaciated, a child suffering from marasmus. You may find this surprising, but this is also a face of undernutrition. Don't be deceived by the chubby, almost healthy appearance of the child except for the patches on the skin. This form of undernutrition is called kwashiorkor. Marasmus and kwashiorkor are in fact extreme forms of a particular nutritional deficiency disorder called protein energy malnutrition, or PEM in short. PEM is caused by lack of energy and protein in the diet, as the name itself suggests.
PEM is a set of conditions which is characterized due to the lack of protein and energy in the diet of very young children. Some of the common symptoms of PEM include growth retardation, loss of subcutaneous fat, and also sometimes the pot bellies or the moon face or edema on the face. Some other symptoms of PEM do include things like hair changes, skin changes, and some other vitamin and mineral deficiencies which normally accompany the PEM.
Now we come to the aspect of how we can treat and prevent PEM. Let's discuss treatment first.
Since the cause of protein energy malnutrition really lies in the fact that children do not get adequate energy and protein in the diet, the simplest way to treat children is also to give them adequate amount of energy and protein in the diet. I must make an emphasis on the role of energy in the treatment of the protein energy malnourished child, because that is the basic deficiency which leads to this condition of protein energy malnutrition. If the child's diet is adequate in energy, then there are hardly any chances that the child will not get adequate protein from the same kind of a dietary pattern. Hence, the major bottleneck in the treatment of protein energy malnutrition really is giving adequate energy to the diet of the child. However, it will also relate to the extent of protein energy malnutrition which exists in the child. We can observe that PEM may exist in a very mild form, it may be there in a moderate form, or it may also be there in a very severe form. Therefore, the treatment or how much energy and protein is given to the child will depend on the extent of severity of the syndrome. The mild and moderate forms can be treated very easily at home by the normal kind of a dietary pattern with a little bit of a supplementation in the form of energy and protein. However, for the more severe forms of treatment, we may have to resort to giving them something which is high energy, high protein feeds, and if the child is severely malnourished, the child may not be able to tolerate it by oral feeding, and under those circumstances, we may have to resort to tube feeding the baby. Most of the time, such treatment may have to take place either in a hospital or in special clinics which are called as nutrition rehabilitation units. However, for a majority of the children, I think it is very easy to treat protein energy malnutrition at home by just augmenting the normal existing dietary pattern of the family with a little more extra energy and protein. And what is a better way of embellishing the diet with extra energy than the addition of a small amount of fat in the already normal dietary pattern of the child? And contrary to belief, children with protein energy malnutrition do tolerate some amount of fat in their dietary pattern. Hence, the easiest way of treating protein energy malnutrition would be to, let us say, evolve certain kind of cereal pulse combinations, because a cereal pulse combination really means that the dietary quality of the protein is augmented because of this kind of combination. As we know, the amino acid which may be lacking in the cereal is found to a great extent in the pulse, and whatever is lacking in the pulse is found largely in the cereal. Hence, an adequate combination of cereal and pulses can really be used to treat the child suffering from protein energy malnutrition. Another feature of treatment is that children lack the ability to eat a lot of food at one time, at one go, and therefore frequent feeding of the child has to be resorted to. Sometimes, since we are talking in terms of the cereal pulse mixtures, they may become very bulky in order to meet the nutritional needs of the child. Therefore, we can resort to certain strategies which will reduce the bulk of the food which is given to the child. And these products are known as ARF-rich foods or amylase-rich foods, which generally bring down the viscosity of the food or the bulk of the food, make it a little liquidy, and therefore the child is able to take much more in quantity than what the child would otherwise be able to take. Hence, with these simple ways, you can really treat protein energy malnutrition. Just as the malady lies in a lack of protein and energy deficit in the diet of the child, the treatment also evolves or revolves around giving much more energy and protein in the daily dietary pattern of the child. The other aspects of treatment of protein energy malnutrition include treatment of associated vitamin deficiencies with appropriate vitamin supplements, as well as treatment of certain infections and other diseases which the child may exhibit by suitable, proper antibiotic therapy.
It's quite obvious that treatment would be based on causes. As the interview suggests, the major planks of treatment are high energy and protein foods, high energy protein feeds for tube feeding of the seriously ill patient, treatment of infections and infestations, treatment of diarrhea if present, vitamin and mineral supplements for treatment of associated deficiencies. Now let's come to prevention of PEM. PEM is of course very much a preventable disorder. At a very simplistic level, it seems rather easy to solve this problem, to prevent this disorder. Just provide enough energy and protein in the diet. But the whole issue is much more complex than that. The reason? There are a host of factors, problems associated with ensuring adequate intake of food. Social factors, economic, even psychological, as Dr. Shanti Ghosh, eminent pediatrician, suggests.
Prevention of PEM is a multidimensional thing. It starts with the family, the community, the neighborhood, and it has many things in it like housing, environment, water, sanitation, and then of course the household level of income, education, knowledge, etc. Socio-economic condition and the buying capacity of the family is only one part of it, and a very, very important part. If they don't have enough money, obviously they cannot buy enough food. But the important thing is the environment in which they live, their knowledge, education, sanitation, hygiene, overcrowding, etc. All these have a tremendous influence. And the knowledge of the family regarding the food requirements of the whole family, particularly of the children, is extremely important. Because you find that the adults can eat whatever they need in the sense that they are hungry and they want to eat. But a young child cannot eat in that way, and somebody has to look after that child's feeding, that is the mother or an older sibling. So unless they are aware of the child's requirements in nutrition, very often this child is underfed. Because this child needs to be fed several times a day, the family may not be aware of it, they may not have the time for it, the mother goes out working. So there are many factors like this which contribute to malnutrition in young children. And then, of course, the young children get repeated infections, much more than the older people get. So each infection takes its own, contributes, of course, to malnutrition. And then there are all kinds of beliefs that families have that most of the food is stopped during any kind of illness, even mild fever. And that further leads to malnutrition. So it's a combination of infection, inadequate feeding, and repeated infection that also contributes apart from inadequate amount of food that is being given.
The interview clearly highlighted the complexity of the problem. That means the solutions are not simple either. We have to eradicate, we have to tackle both poverty and ignorance. These, as you just realized, are the underlying causes of PEM. And this basically calls for long-term solutions, generating more income and nutrition education programs. In fact, these two are the major tools in improving the nutrition and health status of populations. We must realize how important it is to put across messages such as the importance of breastfeeding and the importance of introducing supplementary foods at the right time.
Breastfeeding is extremely important. It is nature's food for the baby. Every species has milk for its own species, and so the human milk is good for the human baby. And we know that it is suitable for the child in every way. It is beautifully balanced for the growth of the child. It has all the essential elements in it. And what is extremely important is that it has got so many anti-infective properties in it. So the children that are given breast milk right from the time that they are born, which we call exclusive breastfeeding, they have far less chance of falling ill or catching an infection than children who are given other types of milk in the first few months of life. And the problem of the semi-solids, of course, is that in India, a large number of rural women start semi-solids a little too late. We feel that mother's milk is sufficient for the child for the first 4 to 6 months. And somewhere around that time, if the baby's growth is inadequate or the baby doesn't seem satisfied with what he's getting, some home-based semi-solids should be started. Something like suji, kheer, mashed potato, any fruit, banana, something of that kind. And this can be started in a small quantity and gradually increased and given 3 to 4 times a day. And the breastfeeding, of course, should continue as it was being given before.
So much for long-term solutions. But what do we do now? What about the children who are already affected or likely to be affected by this disorder? For this group of the population, we need a short-term solution. What is the solution? It's basically giving these children a food supplement rich in both energy and protein. This supplement basically consists of a cereal and pulse combination or a cereal in combination with nuts and oil seeds. Now our attention shifts to another major nutritional deficiency disorder. This disorder is widespread in the case of women. Women in the reproductive age group and pregnant women easily fall prey to this unseen, insidious disorder. This may lead you to think that this disease is confined to women. This is not so. Men and children are not spared either. Now, what's this disorder? You might have guessed. Yes, it's anemia. Now let's try to answer the question, what is anemia actually?
Anemia is a condition where the body is unable to maintain the normal level of hemoglobin in blood.
The definition referred to levels of hemoglobin. How do we use these levels to diagnose anemia? According to the WHO, the levels of hemoglobin in the blood suggestive of anemia are children 6 months to 5 years, less than 11, children 6 to 14 years, less than 12, adult males, less than 13, adult females non-pregnant, less than 12, adult females pregnant, less than 11. Now let's talk about the causes of anemia.
Anemia is caused due to a variety of factors. Some of these factors may be nutritional in nature and others may be non-nutritional. Out of the nutritional factors, the most important ones are iron, folate, and vitamin B12. The lack of these nutrients in the diet of populations leads to the problem of nutritional anemias. Some other nutrients which are also associated with the causation of nutritional anemias include vitamin C and protein and some other minerals and vitamins. The non-nutritional factors include a lot of blood loss due to a variety of causes. For example, in the menstruating women, the loss of blood during the normal menstrual periods may lead to causation of anemia. On the other hand, parasitic infestations are also a very major cause of anemia in populations across the world. These two conditions lead to a loss of blood supply from the individual, which can ultimately lower the hemoglobin level and thus resulting in anemia.
As you just learnt, the causes of anemia can be nutritional or non-nutritional. If a person bleeds heavily, anemia will result. Similarly, if a person is harboring germs or parasites which attack and destroy the red blood cells, again anemia will result. You can see how malaria parasites, for example, attack and destroy the RBCs. We will confine ourselves to the nutritional anemias, iron deficiency in particular. Now this would bring us to the question of how does iron deficiency lead to anemia. This particular flow chart gives you the answer. Iron is used by the body to form hemoglobin. In fact, the hemoglobin molecule looks something like this. As you can see, iron is part of the heme of the compound, which is itself attached to chains of globin, which is a protein. If iron is lacking in the diet, not enough hemoglobin is formed. The role of folic acid and vitamin B12 is basically to aid in the process of red blood cell formation. Their deficiency, therefore, also causes anemia. Now, why is the lack of hemoglobin so important? Why is it so dangerous to the body? Hemoglobin basically transports oxygen, which is essential for maintaining life. Our muscles cannot work without it. No work would be possible without it. Oxygen rides piggyback on the hemoglobin molecule somewhat like this. When hemoglobin is lacking, the oxygen cannot be transported, and therefore the body cells cannot function properly. The person cannot exert at all and starts panting on the slightest exertion. In other words, the problem starts showing up as symptoms. We talked to Dr. Watwani about the symptoms she comes across in patients.
Most of the time, patients are asymptomatic. The development of anemia is so gradual that the body adapts itself to the condition, and patient hardly complains of any symptoms or shows any signs. But in general, the usual signs are weakness, easy fatigability, loss of weight, loss of appetite, and vague gastrointestinal symptoms. Patient may be having a low fever. There may be lack of concentration, headache or giddiness, or patient may have fainting attacks or blackouts. In sign, we see the conjunctiva, which will be showing pallor.
We know that both iron deficiency and folic acid and vitamin B12 deficiency cause anemia. How do we differentiate between the two? To do this, we need to look at the blood picture. This is normal blood. Blood, as you can see, contains tiny red colored cells or RBCs. It is here we find the clue, so look closely. In iron deficiency anemia, RBCs are smaller and lighter in color. This is called microcytic hypochromic anemia. Microcytic meaning small cells and hypochromic meaning less color. On the other hand, in folic acid and vitamin B12 deficiency anemia, RBCs are larger but are usually normal in color. A number of improperly formed RBCs also find their way into circulation. This type of anemia is called macrocytic normochromic anemia. Macrocytic meaning bigger cells and normochromic meaning normal color. So what's the solution to the problem? What preventive or prophylactic measures can we take?
Anemias can be prevented using a large number of strategies. One of the most important strategy, however, deals with the dietary diversification of the population. We need to promote those foods which are rich in the nutrients which cause nutritional anemias. These foods should be rich in iron, and as well as they must also have more of vitamin C, which acts as a promoter of iron in the diet of the population. In this context, it may be mentioned that the use of sprouted pulses is a very good idea, because along with the iron and the protein which is present in the pulses, it also improves the bioavailability of the iron from sprouted pulses because of the amount of vitamin C which is present in the sprouted pulses. Similarly, other factors which promote the absorption of iron include things like animal foods, like meats and fish. To the extent possible where population can afford to have these foods will promote the absorption of iron in the dietary pattern. Similarly, there are other factors which have an inhibitory effect on the diet of the population, which include things like tea, which includes tannins, which again are acting as an inhibitor of the iron. The other strategy, which is important, can be the use of supplementation during at least the at-risk population groups like the pregnant mothers as well as the preschool children. There is a national program which is based on the supplementation of the pregnant mothers to the extent of 100 milligrams of iron and 500 micrograms of folic acid as tablets for a period of 100 days during the period of pregnancy. Similarly, for the preschool children, the pediatric dose of iron folate tablet includes 20 milligrams of iron as well as 100 micrograms of folate. This tablet should also be given to the preschool child for a minimum period of 100 days every year. The third way in which we can prevent nutritional anemias is to make sure that the hygienic conditions do not promote the extent of parasitic infestations in the population. Regular deworming of the population to get rid of the parasitic infestations would also help to promote the absorption of iron and hence control the nutritional anemias.
This chart gives you a quick look at the major sources of energy, protein and iron. Energy first. Energy is supplied by cereals, roots and tubers, sugar, jaggery and fat. Protein is supplied by pulses, milk, fish, meat, nuts and oilseeds. Iron, the sources are liver and other meats, fish, poultry. These sources contain iron in a form which is easily absorbed. Then we also have iron in green leafy vegetables, whole cereals and pulses, lotus stem and some of the other vegetables. In these sources, iron is not so available unless it's combined with vitamin C.